Hey there, it's Dr. Roger Moczygemba at Direct Med Clinic. So now there are mandates for employers to vaccinate their employees for COVID-19. Well, there is pushback on that, or there can be, like what happened at Methodist in Houston, where 150 employees resigned because they were mandated to have the vaccine. So, as an employer, how do you protect your employees if they don't want to be vaccinated? Or how do you protect your vaccinated employees from getting COVID? Because we know now that there are breakthrough cases of people that are vaccinated getting the disease. Well, the answer is to offer them early treatment. Early treatment is a thing, as is pointed out by the American Association of Physicians and Surgeons. They put out a guide for COVID treatment, and in that guide they talk about the 4 pillars to control a pandemic. The first one is prevention, the second one is early treatment, the third is hospitalization, and the fourth is vaccination. So early treatment is an option. It should be considered. There was a review article that came out in July-August 2021 in the American Journal of Therapeutics, which looked at the use of ivermectin in prevention and early treatment, and the results are compelling. Let me read you from the conclusion, and I quote, "Evidence finds that large reductions in COVID-19 deaths are possible using ivermectin. Using ivermectin early in the clinical course may reduce numbers progressing to severe disease. The apparent safety and low cost suggest that ivermectin is likely to have a significant impact on the SARS-CoV-2 pandemic globally." Close quote. So you can see that's very compelling evidence for early treatment. Now, if you're a visual person, you might like this graph. We can see the dark line, which is the number of cases, starts to rise really dramatically in April. Then following that, the red area represents the number of deaths, which is rising right behind the number of cases. And then towards the end of April, we see the shaded area, which represents when ivermectin was included in the treatment protocol. And literally within about a week or two, we can see that the curve turned around and went back down to the baseline, all within about a week or two when ivermectin started being included in the treatment protocol. So this is really compelling evidence for the use of ivermectin in early treatment. So as a doctor and owner of my clinic, we contract with employers directly to provide affordable access to care and other services that are not available through insurance. We do this through the model called direct primary care, otherwise known as DPC. So it's from this perspective that I was thinking about the dilemma that business owners and employers have with this proposed vaccine mandate. And it was my goal today to provide an alternative for those people, employees, that do not want to have the vaccine, to provide an alternative to them for care against COVID, and that's achieved through early treatment, as the evidence that I've presented suggests. So I, as a employer myself, I feel the struggle to make the right decision for your employees and for your company. I hope this information has been helpful. This is Dr. Roger Moczygemba with Direct Med Clinic.